Hello, everybody, and welcome to another episode of Fireside Chicago, where we host fireside chats with prominent leaders from Chicago's business community, live on Zoom with Q&A every Tuesday, Thursday at 11:30 a.m. Central Standard Time. I'm your host, Tim Shum. I'm also the founder and president of Lucas James Talent Partners here in town. We have a fantastic guest here today, Dr. Rahul Khare. He's going to be chatting with us a little bit about COVID. He's a serial entrepreneur in the healthcare space. Looking forward to that conversation. Before we get to the conversation with Dr. Khare, I just want to highlight some of the guests that we have for the remainder of June. Next Tuesday, we have Michael Krassman, co-founder, CEO of Urban Bound. He's also the co-founder of Hirology and 3 other businesses that he sold. Serial entrepreneur. Really looking forward to that conversation. We have Matt Silver, co-founder and CEO of Forager. Forager's doing some really cool things in the logistics tech space. They just raised a bunch of money. Looking forward to that conversation. Tuesday, June 23rd, John and Seth, CEO and president, respectively, from IDX Technologies. Dr. Khare, you might be interested in this one. IDX is the first FDA-approved AI diagnostic tool to diagnose severe diseases. So they have a great product pipeline, future of healthcare. Tune into that if you're interested in that space. We have our second ever jam session, June 25th. We're hosting 3 heads of people at organizations in Chicagoland. Shout out to the HR reps, shout out to the talent acquisition management people, leadership and development, organizational development people, getting hit really hard and have a lot on their plates with this COVID situation. So tune into that for sure. And then last but not least, June 30th, Brent Sopel, former NHL professional, former Chicago Blackhawk, former Stanley Cup champion. Most importantly, he's the founder and CEO of the Brent Sopel Foundation, focused on helping children with dyslexia. Moving along to our guest today, Dr. Rahul Khare. Prior to becoming an entrepreneur, he was a 12-year emergency medicine physician and associate professor at Northwestern, turned entrepreneur. He's the founder of Innovative Care, a group of medical practices that are changing the way healthcare is delivered in the city of Chicago. Of the 3 businesses, Innovative Express Care is an urgent care facility located in Lincoln Park. Innovative ketamine-focused facility on clinical depression and pain disorders. And then last but not least, Innovative Wellness, a medical cannabis practice focused on education, consulting, and certification. One of his facilities was also one of the first COVID-19 testing facilities. So we have an individual that's been on the ground fighting the good fight this entire time. Welcome, Dr. Khare. Thank you so much for carving out some time for us.
Thank you for having me.
Absolutely. Absolutely. So I got so much I want to talk to you about. We had a little prep session a couple weeks ago. Let's just start with COVID. I think that's on everybody's mind right now. Maybe just help us summarize in layman's terms, of course, your experience from, say, January, February 2020, and then kind of fast forward to where we are today. We're filming this on June 11th, 2020 from your experience.
Yeah, I mean, there's so much I can talk to you about it. We were kind of going through our numbers in early March and saying, God, we have to increase our volume. We're always trying to push. What can we do marketing wise? Can we reach out to our patients to let them know? Summer's usually our slow period in the urgent care because, winter, obviously, you've got the coughs, the colds, the flu shots. Summer, you got, camps and things like that and some injuries outdoors. So we were getting prepared for that. And then, I started seeing what was going on in Italy. In Wuhan, I was really just curious. Then when I hit Italy, which is one of my favorite countries, I go there as much as I can. I know for a fact they have one of the best healthcare systems in the world. And so when they were overwhelmed and we're starting to see high numbers of infections, I knew it was real. I just flipped the switch, and all of a sudden in late April, early March, I started ordering a lot of the PPE. So I knew the N95 masks would be in short demand or short supply. Those gowns that are really important, I started buying a lot of those, and then starting to talk to my labs about, you guys think we'll have COVID-19, and a lot of them weren't sure. So I went to Quest and went to some of the big labs, LabCorp, and said, hey, can you guys assure me, like I'm a small I'm a small business. They're going to go to the Northwestern's advocates, but can you just carve out just a small amount for me? And they said, sure, we'll do whatever it takes. They thought I was crazy for the most part, because I started talking about COVID all the time. And then the Block Club, which is a local newspaper here, kind of got a hold of me because I was talking about it so much. I think I went on WGN radio and started talking about how this COVID-19 is going to be a big deal. And they wanted an article. And then I said to myself, I have to get prepared for it. And so we started seeing first few patients trickle in. And we were doing it inside. Remember, it was early March. It was really cold outside. So, but I was thinking, we got to get it out of here, because the smell of Lysol and the contagiousness of this. And remember, we didn't know much about COVID-19. We were all scared. And people were saying we're overblowing this. Some people were saying we're not taking it seriously enough. So I was like, when we got inside, everyone was taking our medical assistants, and everyone really kind of afraid, because we were taking off our gowns and we were Lysoling, and there were weird protocols going on. And I said, we got to take it outside, because in the tent and natural light and with the elements of the wind, it's harder to be as contagious. So we got all our PPE. We started going out in the tent. We started renting a space in our parking lot. And we had it all prepared, and then the surge came. And when we were seeing, as an urgent care, about 50 to 70 patients a day, we turned that into 500 to 600 patients a day. And pretty soon, insurances said, hey, if patients don't have insurance, we'll cover it. Well, the government said that, and the insurance said no copays, no, we'll take care of all that, no out-of-pocket pays for our patient. So it became a very good business for us to help take care of our community. And this was a time where the hospitals weren't actually testing that many patients, because they had to go through the CDC or the public health system, where you had to be very sick to do the test. And since we went private and I had enough tests, and patients were paying for it, or the insurers were, we were able to do it. So it was kind of the perfect storm for us. And I did all this because I used to go down to Haiti. After 2010, they had a huge earthquake, and we were with Northwestern, one of the first responders down there. We made our ER out of tents, because we didn't want to be inside. So I had the background for this, and we just set it up, and it's been good. Yesterday, we tested 250 patients. So it's continuing on from early March till now. We're in mid-June.
The folks that were coming to your facility in March, was it, severe symptoms only? That was it folks that tried to go to the hospital but didn't have the symptoms, that wanted to see if they had it? Was it folks that didn't have any symptoms that were just fearful that they might have caught it? Or was it a mix? Or can maybe elaborate on that a little bit?
So it was a mix, and there were a significant amount of people who were what I call the worried well. That's what urgent cares do. We take care of the worried well. If you're really sick, you're having a heart attack, we all know you have to go to the ER. But so we're used to that worried well population. So what I set up was actually a screening with telemedicine. So they actually had to do a telemedicine screening with us. And if they didn't really have any symptoms or just concerned, we said, you know what, now's not the time to get tested. But if you get any of these things, please come back. You don't even have to do the telemedicine. We'll test you on the spot. And a lot of those worried wells were really happy. They were just like, I talked to a physician. They said there's nothing for me to be concerned about. They listened to me for 10 minutes and asked me the appropriate questions. I have a chart in the system. But if I get any of these things, I come back in. Or if they had a fever, it was early March, we brought them in and we tested them. So we kind of used technology and telemedicine to kind of take away those people, because what we didn't want, there's these worried well to come into our waiting room and actually get sick.
Yeah, right.
So it was great. We used telemedicine the way it's supposed to be used, and it did well for us. And we're still using telemedicine for people who want to get in and get out quickly.
I would probably describe myself as probably the general population. I've been pretty hunkered down. I don't think that I have it. I'm not exposing myself, or the family's not exposing themselves as much. But I'm only reading things on the internet, or word of mouth, or CNN is kind of my source of information. For someone that's being on the ground, maybe talk a little bit about what's been going on with the testing, the different types of tests, the amount of false positives or false negatives that have been out there, how that story has kind of gotten to where we're at today, and where you see that testing going in the future.
Right. So this is something that I've kind of been an expert on, because I have to make sure that I have the right test for my patient population, which, I'm in 60614. I'm in Lincoln Park. These are professionals, and unfortunately there are dermatologists and even dentists who are doing some of these antibody testing, and who may get tests that aren't very good. I mean, this is the type of place that I want for my family members to get tested. So first and foremost, there are two types of tests. One is to just recognize if you have the virus itself. We call it a swab test. It's a live virus test. So for those tests in particular, there's the ones we send to the lab, and there's the ones that we actually do a point of care testing that's like a flu swab or a strep swab. Unfortunately, because this is a very new virus, a lot of these tests haven't been verified very well. So one of the quick tests that is done by Abbott, President Trump, showed everyone how great it was. Well, we fast forward a month, this test was not very good. It's about 60% sensitive, so not good at all. And so what I decided to do with us is, like, if you have symptoms, let's do the real test that gets sent to the lab. It does take 2 to 3 days to get back, but for sure if you have it or not, because the sensitivities are very good. We had to do all of that with the antibody test too. You would be a good candidate to get an antibody test, and that's, have you been exposed to COVID-19? And even if you haven't, we do have some people that have asymptomatic carriers of antibodies. So that test, we used to have a finger prick for it. I only we trialed it out. I didn't really like it. The sensitivities weren't very good, so we sent those out to the labs too. The turnaround time for that is a day. That's not as important, because that's just showing you if you have antibodies. It's not like the virus itself where you want to know within a day or two of that. But we have a good test that we sent to our Northwestern lab, and we get the test back like that. So for me, the importance of innovative express care is to get the right test for my patient population, to give them the best test, so that we're competing and we're giving them the right information. Because I think you can take a lot of shortcuts, but we're dealing with healthcare, and you don't want to do that. So yeah, we've been trying to find the best test, and right now we're sending to our Northwestern lab for both the swab test and the antibody test, and we have the ability to use cheaper tests, but the truth is it's not worth it to me. So I'd rather not make as much of a profit margin to get people the best test, and we want to make it very transparent. So we put it on our website, exactly the tests we have, and the turnaround times, and you can go to other places that can get rapid tests, and that's not a problem. It's just not going to be as sensitive. We've just added on a rapid test with us, and we're still we are giving it out in a case-by-case basis. But one thing we're doing is we're sending out the lab test as well. So you're getting actually 2 tests, and we're covering one of those tests, because I think it's important to get the right results.
There's been a lot of just storylines out there, and you said it before, like, this is a new thing. The storyline is changing every day. We're learning about the virus is changing every day. You have folks that, maybe have some cognitive dissonance. Hey, if I don't read anything because it may or may not be accurate, then maybe there is no virus if I don't pay attention to it. There's folks that are 100% convinced second wave's coming, this is happening. You hear stories around, hey, the actual death rate is extremely low because we're only testing a certain amount of folks, and the ones that have symptoms. What's, in your mind, what's your take on COVID-19 as it relates to how maybe, folks without that day-to-day information that you have should look at it?
Sure. No, I think we all fall into that. I mean, how does it affect me? That's really what you want to know. So you got a lot of questions there, but I would say this. Obviously, COVID-19 is real. It can cause death in certain patient populations. I'm not here to scare everyone. For I don't know your medical history, but without any chronic illnesses, I don't have any. The likelihood of me getting it and dying is very low. It's less than 0.5%. That being said, I go visit my mother, right, who's a different category. She's in her 70s, and if she got it, there would be significant issues, hospitalization, and even death. So, and my children as well, who go over and see her. So now all of a sudden, we're all connected. And it's very important that we understand the risks of giving it to people who do have comorbidities or who are elderly. And for that point alone, we have to take this very seriously. Now, can I go to a restaurant this week? It's beautiful today here in Chicago. Can I sit down? Yeah, I can. That means putting a mask on while I'm out there, but when I get to the restaurant, sitting down, for me, that's fine. But then I'm increasing the risk of me getting it, and that means I have to be very careful about seeing my mother and my grandmother and all the elderly people like that. We're now seeing, let's say, Wisconsin open up. We saw Florida open up, and we're all afraid of like what's going on. We know that Florida, Georgia, and some of the southern states are seeing a bump in patients with COVID-19. But we have to be very careful with this data. Wisconsin did not have a huge bump at all. They opened up pretty early because of the Supreme Court overturning some of the things. But that being said, when you literally look at the data came out today, a lot of patients have stayed at home. They're sheltering in place. There's only like a couple of counties that are going out. So you can't generalize all of Wisconsin. Whereas Florida have seen a significant increase. They have not really sheltered in place very much in the last few weeks. So it's still mixed messages. I think if you have any comorbidities or live with someone with who is elderly or comorbidities, you have to be very, very safe. And then we could get into the ethnic disparity of what's going on. Hispanics have more COVID-19 than any other ethnic group, and then or racial group. Blacks are second most, right? And the question is like, why is this going on? And I think this is a fascinating health services question as well. And the truth is, people who have means to shelter in place are decreasing the transmission of COVID-19. When you have close communities, and the Hispanics have this beautiful culture of many generations living in one house, but the problem is with the virus, that's a problem. So there's an increased amount of transmission. They do a great job of childcare within generations, which I think is beautiful. But the problem with that is the childcare is going from grandmother to mother to cousins and spreading it quickly. So we'll get all this information, unfortunately, in 6 months to a year when the data comes out. I'm seeing it on the front line, and it is fascinating to me. I think the most important thing we can do is we need to reopen up. We all believe that businesses have to continue on, but it is now a personal decision, and it's your it's very important that you have to take your factors of who you're caregiving to, and if you can limit the amount that you are with the elderly, if you are going out to restaurants and going to protests, going to what I would call somewhat unsafe environments, then you have to take that into consideration when you do go see your parents or grandparents.
This whole situation has been, you're right, there's so many variables that are at play here. So for me, with no healthcare background, I took some statistics classes in high school and college, and I'm looking at these data points, right? Oh, the cases are increasing. But, why is that? Is it because we have more access to testing? How is that converting to hospitalizations? And it's just really hard to come up with what the true story is. And you're seeing that in the media too, because you have people like me that are coming up with their own stories for maybe an agenda, putting things out there, or maybe they just don't have all the variables at play. It's very difficult.
Yeah, and I want to extrapolate on that. You're exactly right. Yesterday I was on the news talking about, it's not one data point. You cannot look at the amount of the positive rate, because there's a lot of reasons why all of a sudden people are getting tested. We are sending people to factories, to restaurants. I'm sending my medical assistants. We're doing 50 to 100 swabs, and these are asymptomatic patients. So the positive rates on those are 0. on some of them, or they're like 10%, depending on where we're going, what neighborhoods we're going to, and what kind of workers they are. But you see that the positive rate can't be used alone. You can't use hospitalization rates alone, because that has a problem. You can't use we call it the R naught, which is how many people that, if you have COVID-19, how many people that you actually infect. It used to be 2 to 2.5 in the peak of this. Now in Illinois, we're below 1. And so you have to use all three of those as a dashboard to see what's going on. And no one has real-time data to that. Even our CDC and our public health department in Chicago have minimal data to that. So it's hard to make decisions. Pritzker and the governors have to make decisions based on very much a moving target. And so it's a little bit complicated. But I think what's important is that people like you know that there are risks to going outside. There are risks to opening up your business again. We do have to take precautions of using masks and social distancing. It is important to get testing maybe once every 2 weeks to see if you have any outbreaks going on, so you can isolate those people and it doesn't shut down your business again. So there are ways to do this, common sense ways that, that Innovative has to really help people so that they can get back out to work in a safe environment.
What would you say to, I'm a business owner, you're a business owner. There's manufacturing facilities out there. There's big offices. There's people just kind of just jonesing to get back to the way things were, maybe with overlooking some of the things that we're talking about today. What if, you're talking to a business owner, politicians, what would you say, hey, if we needed to go back to an office setting, a manufacturing setting, what would be some of those precautions that you would take, or policies, processes that you would take to maybe limit the amount of infection or protect some of the folks that check a lot of the boxes that may be prone to more severe symptoms of this?
Right. I think the most important, there's a lot of things that they should do. A lot of the corporate offices downtown are doing this because we visited them pre-opening and, consulted with them with like, hey, you need 6 feet apart. You need these cubicles you have to do every other, certain amount of people in the elevator and to go to the bathroom. But more importantly, it's really taking care of your high-risk patient population. Anyone over 60, anyone with comorbidities, even with asthma. If there's something you can do to support these people to not jump back into the office space, it's really important to do so. And I think from an HR and from a supportive company, we have to pay a little bit more or support these guys for them to not come in, to retain their salary, but maybe put them at 80-60%. Maybe they can do what they can from home, but you have to support them for at least a month or two until this virus, the number of people who have it in Illinois goes down pretty significantly. And so I think what the government is doing is they're giving free healthcare to people. If you don't have insurance, you can actually get tested for free. If you get sick for COVID-19, you can come to my office and we will build a government who will pay us for that visit. So they're starting to give these things, but us as individual CEOs and business leaders, we need to support our own employees by asking them, hey, we don't know your medical history. We can't. That's illegal to do so. But if you feel you are unsafe to go back to the workplace, can we have a discussion about it so that we can set something up that you're comfortable with and that will make it the least likely of you getting COVID-19? Because it's not me or you that I'm worried about getting COVID-19, my kids, my wife. It's not at all. I'm not worried about that at all. I feel very fine about that. It's my mother, my father, some of my employees who have asthma and some other chronic conditions that I'm really afraid of getting it. So I think taking it to that level, not only will they be indebted to you, but it's the most common sense way to do this. And so I think we have to start thinking like that instead of this blanket approach to helping people, because this is a very interesting virus and it hurts and kills some people and doesn't do anything, or very mild flu-like symptoms in others. And you can't look at everyone like they're going to die. You have to look at it specifically by age group, by comorbidities, and then you can feel more comfortable opening up and knowing you did the best you can to keep your employees safe.
Very well said. Very well said. We have a question coming in from Amanda Schleedy for you. So Amanda is a human resources consultant to other companies. She asks, is your practice providing employer on-site COVID-19 testing? Or are you aware of anyone who's providing those on-site services for employers, maybe if a coworker has tested positive?
Yes, we are. And the reason we're doing it is because we started testing a lot of the business leaders here just as patients, and they started to reach out and say, hey, I'm restarting. I need some help. We have 2 known positives, and I'm afraid I'm going to bring everyone back in. We're going to start and then going to stop again because we're going to have an outbreak. So can you help me figure out a way to prevent that? And so we now have a group that goes to, in fact, we're out here right now in Chicago. There's 4 people, a provider included, who's out here testing 50 people before they go back into work. And we're scheduled to do it again in 2 weeks to ensure that it's continuing to be COVID-free, and we can isolate quickly to do that. So we have the ability to do that. The beauty is it's not very costly at all, because what we're doing is we're taking the patient's insurance and we're billing through their insurance, and the employers are saying that they will cover anything that the insurance doesn't cover, which usually is nothing. Insurance is covering 100% of the testing and the doctor's visit. So it really is no added cost to employers to do this. So I strongly encourage you. Obviously, you can come see us at innovativeexpresscare.com, and we have an occupational health section there, and you can reach out to us. A lot of people aren't doing this. Doctors' offices aren't doing this because they don't have enough PPE or personal protective equipment. They don't have a setup like we do. So right now, even the traditional occupational health that most companies are going through, they're not ready for COVID-19, interestingly enough. They're usually doing drug testing and their normal stuff that they do. So we're here to help people. It's really not much out-of-pocket cost to employees. And if your employees do not have insurance, you don't even have to pay for them. The government has set up a way to do this. So, I say, if you are going back to work, please give us a call or drop us a line, and we'll talk to you about what we do and how we do it. And we can do it very quickly because as COVID-19 goes down here, testing goes down and innovative, we want to test more people at their workplace where they are.
There's another question from Amanda, and I think this is on a lot of people's minds. Is there, or can you have employees complete kind of like a daily check-in kind of test, or is that simply just a temperature check before entering the workplace?
Yeah, so great question. And this is all information we can give you for free as a consult when you're talking to us. But I will tell you right now, it's pretty simple. And I've evaluated this and talked to a lot of people a lot of experts about this, and occupational health experts. We recommend everyone, especially in this next month, to do daily temperature checks. So anyone who gets 100 degrees or more is kind of sent to us to get swab tests, and then needs a note to return back to work, because the last thing we want to do is return someone with a fever who has COVID back to work. So fever and a simple questionnaire: do you have any body aches, cough, or shortness of breath? So that's the only 2 things that you have to do when you enter the building, or even when you're in the building, and you just get those done. Those are documented on a Google sheet or whatever, and that's a great way of self-reporting, as well as screening with temperature. And the other thing is, if you have a good policy that says, hey, I don't feel comfortable of going to work, then maybe you can reduce the pay by 80% and say you can work from home, and this is why we have to reduce it, because you can't do everything you can. Something in place that makes people want to go to work, but also gives them the choice to, if they don't have to stay at home. That won't hurt you guys. So policies like that are really, really important to put in place. But yeah, daily temperature checks, daily how are you feeling checks, and also some kind of protocol, how many people can go in the bathroom at one time, the elevator protocols, and reducing the amount of crowding that occurs. Those are the best things we can do. Those are common sense ways to get back to work without shutting down your business.
Very well said. Thank you, Amanda, for the questions. Man, we could probably go on and on about COVID. I do want to carve out some time, and maybe we could have you back when things kind of settle down for you a little bit.
Sure.
This show is just about talking shop, about entrepreneurship, about business, your background, ER physician, associate professor, now turned entrepreneur. Maybe with the time that we have left, let's just kind of talk about your story of starting these facilities, a little bit about the 3 facilities. And where you stand today and how your business is operating.
Yeah, so basically, when I got out of residency at University of Michigan, got recruited and took a great job at Northwestern, one of the best hospitals in Chicago. And we have great health here in Chicago with Rush and Loyal, and all of them are wonderful. But I wanted to be an academic, and so I started going on that path. And around when I hit 40 years old, I'm 45 right now, I looked around, I was doing an overnight, and I was like, I don't want to do this in 10 years. It was burning me out. And at the same time, I was doing a lot of research on how people get their health care in general. So primary care, emergency room, urgent care, and how we can give, using technology, give better care to our patients. So instead of I was doing a lot of research on this, and instead of getting a grant to research it, my chairman, Jim Adams, who I'm grateful for, he was the chief medical officer of Northwestern, said, get a grant, get a small business loan, and try to do it yourself. And if people start coming back, you know that you're doing the right thing. So I did that. I saved up $100,000 as the down payment of a small business association grant. They gave me $900,000. It takes about $1 million to open up an urgent care with staffing and run rate and all that stuff. And first day, I had 5 patients. One of them was my mom, we started to grow. I will tell you, during this time, I had to borrow money from my mother. I was 40 years old to make payroll. Like, it was a small business, like we've all done before. Had to do that for 2 months. It turned the corner. Now we're seeing over 500 patients a day, and we're doing many of those patients through telemedicine. And all we did was we started with a minimal viable product, and we started with an urgent care. We asked the patients what they needed, and we quickly learned that patients we don't need more urgent cares in this world. That's for sure. We have so many on every other block. What we need are people to be able to see doctors in a quick and efficient manner. And unfortunately, primary care doctors are all full. So what I decided to do is let's get more primary care physicians alongside an urgent care. So when they couldn't see them, the urgent care could get the extra patients. So that's what we did. We now have 5 primary care providers. When they can't see their patient in real time the same day or next day, they come to the urgent care, and the primary care often pops their head in and says, hey, you do have strep. The urgent care doctor has said to take your amoxicillin all on board. And patients love that. It's a new model for them, because usually they know they don't even call their doctors when they get sick because they can't get in nowadays. So we're creating a new model of healthcare, and one that's focused on what patients want. As soon as we did that, we noticed that people have minor depression, minor anxiety. Significant amount of patients here do. And we didn't have good luck of getting patients in with psychologists and therapists. So now we have 5 therapists on board who can see patients within a day or 2 of getting wanting help. So all I'm doing is growing these new businesses based on what patients really are asking for. And when you do that, the demands are high. It's not a gamble. I know there's a need. Medical cannabis certification is a great example. I'm a big proponent of cannabis as a medication, but a lot of doctors didn't feel comfortable doing that. So now we have an entirely new business that is protected by its own business entity because it's cannabis, and this has this federally illegal, but in state-wise legal. And so we certify patients for that. And then we also have a ketamine clinic, same thing that we did there, and a med spa, same thing that we did there. So that's how we kind of grew. And one of the biggest things we're doing is using technology to help patients get what they need. So telemedicine is the way to do that. And right now, when COVID-19 hit, we were doing about 10% of our patient population on telemedicine. Well, that increased up to 80%. And it was just a flip of the switch because we'd already been doing it. So it's been nice for us. COVID-19 has helped us use our technology the way I've always envisioned it doing. So it's been a good run for us so far.
There's so many different industries that have been disrupted with different models that become tech only, tech enabled. You kind of think of healthcare, going to the doctor, as almost like an institution. It just like it is what it is. You kind of deal with it. And it sounds like you're taking that approach that really any other entrepreneur would, is, keep your ear to the ground, talk to your customers, get a feedback loop, continue to innovate, move the needle, and progression and change is the only constant. And, who knows where that'll take you. So yeah, kudos to you of having that approach. Part of me wishes I lived close to Lincoln Park, and I could pop in every once in a while with you. For
sure. Well, one of the first business books I read was, lean methodology. And it's something that I love. I'm an entrepreneur. I've taken an Enneagram. I'm a 7. I'm always pushing the limits. And this has been good for me because I don't, a lot of people say, hey, you need good feedback as a provider, as a physician. It's really easy for me. I hear it all the time. I talk to my receptionist. They tell me, hey, listen, people start getting mad after they're waiting for 15 minutes. So one of my goals is no one waits more than 10 minutes, right? Let's just, if they do, I need to know about it, which means that, people come to me and say, hey, it's a 10-minute mark, and I'm the pop-off valve. So if the provider is the bottleneck, then I'm like, get them in room 3. I'll go and see them. That's no problem. So lean methodology is what I love about it is, and what I drive my employees crazy is because it's not the perfect product that I put out there, but we put the product out there and then we innovate and we make that product better and better every day. And so whether it's telemedicine, whether it's the model we're using where primary care and urgent care are together, we've had to really change that until it works really well. And we've been able to do it in the last 5 years to enable that. And now we can start growing and replicating this model and possibly even get private equity money to really put 2 or 3 of these in Chicago as well as nationwide. So I'm really excited about it. And there are a lot of healthcare companies out there, One Medical, Forward Medical that are out in San Francisco, CityMD, which is in New York City, and they all have different models. And for me, I love studying these to understand, well, they all have problems with them. Can I make something that will give exactly what the patient wants? And they can be done seeing us and just say, wow, innovative was really cool. I didn't even have to get in. I didn't move. I used my insurance. I don't have to pay a subscription fee. I don't have to do concierge medicine. I'm getting really high quality care in a really convenient manner using my insurance. And that's what I want all my patients to really feel.
Yeah, I mean, kudos to you in the healthcare space. I think, there's definitely put yourself in the customer's shoes and then kind of evolve around there. But you got to worry about, risk, compliance, regulation. You got to kind of adhere to or work around some of the insurance policies, I would imagine, that are out there. So to be able to do that in that space, I think there's some white space there, and it looks like you're tackling that.
Yeah, I mean, on that one point, one of the problems with healthcare is the insurance. I mean, you have to really take it. A lot of people don't, right? And you call them concierge or direct medicine and all these things, but 80% of the patient population want to use their insurance. I would say 90%. Actually. And the problem with insurance is there's a lot of red tape. They give you the money, you can't negotiate it. But one of the hardest things is usually with a Prada bag or any widget, once the demand gets higher, you can start to raise your prices. And that is the beauty of an open market. But with insurance, you can't. You really can't. And at the end of the day, then you become a volume-based business. And in healthcare and medicine, when you become a volume-based business, your quality goes down, right? So there's this catch. You have to be in this good spot of, you know what, you have to get a good amount of volume, but you can't overdo it, or else your quality goes down and people start yelping and Google businessing like, hey, I felt like a number. But, you know, and then there's the, you can use, instead of doctors, nurse practitioners and PAs. So you can play with those things, but if you get too many of those, you know, people are like, I want to see a doctor, right? So can you make it where for colds and coughs, you see an NP or PA? For, you know, something where it's a little bit more complex, you know, then can you see and raise that up to a doctor, right? And so this is the challenge that I'm having as just a small business owner in healthcare, is how to give patients the highest quality of care, perceived high quality of care, and to make some profit on it so that we can continue to grow the business. It's a very challenging thing to do, but it is also really fun to do for me because I have a lot of fun doing that.
But most industries and businesses are around convenience to the end user, and
Yep.
stuff's pretty convenient right now for the most part. Except going to the doctor,
Yeah.
right? It's almost to the point where people don't go because of that. And there's major issues with that. So kudos to you to tackling that problem. Only 5 years in, got a lot of stuff going on. I'd love to have you back at a later date to talk more shop when things settle down for you. Thank you so much for carving out some time for us today, educating us on what's going on with COVID-19 and talking about your business. If folks in and around Lincoln Park, in Chicago, maybe a business owner that wants to take advantage of your on-site testing services, where can they reach out to you or your business?
Yeah, just go to our website, innovativeexpresscare.com, hit on the COVID-19 section, and there's a huge section on occupational health. We have a whole team that'll get back to you on the same day because people are scared. People are reopening up this week, next week. The protests had stalled it for a while, and they don't know what to do. Just talk to us. We'll give you free advice, like even if you don't use us. We're a good resource to, if some of your patients do get sick, to send them over here. We'll test them and get them going back to the office very quickly. So for me, I think the most important thing is like, just give us a call. We'd love to talk to you about it, because I think that's the next issue with COVID-19 is how do we live a normal life, back to work with this virus going around. And like we unfortunately are seeing, it's hanging around for a while. And even though our numbers are decreasing, there might be a little bump coming up this winter coming up. And even because of the protests, we're seeing a little bump and increase, which affects us all, because even though you might not be the patient population that got sick, you're working with them. They're around all the time. So come see us. We'd love to help out.
Thanks so much for everything you're doing on the ground floor, fighting the good fight. We'll talk to you soon. Take care.
All right. Thanks for having me.